Good afternoon, and welcome to today's caregiver panel conversation, Navigating Care, Recognizing When Your Loved One Needs More Support. My name is Allegra Jaffe, and I am the supervisor of the Caregiver and Supportive Service Unit with the Fairfax Area Agency on Aging. A few housekeeping items before we begin today's session. Today's presentation is being recorded, and the recording will be sent to all the registrants within the following week. We'll also provide you the slides that we're going to be sharing today as well. We have enabled closed captioning. So if you need closed captioning, you can turn it on your Zoom panel link on the bottom of your Zoom. We also will be taking questions throughout our time from the audience. You can use the Q&A box to type in your questions. We do not have chat enabled, but there is a Q&A box. It should have an option on your little bar on the Zoom bar. So you can type in those questions, and we'll do our best to get to all of those as best as we can today. And at the end of our session, there will be a brief survey. It would really help us if you could fill that out. Let us know what type of content you're interested in. We really do want to make programming that's interesting to our family caregiver community. And so I will now introduce our first panelist today, and that will be Camden Doran. And she has been working with older adults for 24 years. In 2017, Camden joined the Northern Virginia Long-Term Ombudsman Program as a staff ombudsman. And during her tenure in the Northern Virginia Long-Term Care Ombudsman program, she has developed intricate knowledge of policy and procedure and has built additional leadership skills through management of the volunteer program and program staff. Prior to joining the Northern Virginia Long-Term Care Ombudsman Program, Camden provided case management and services to older adults, including community-based service referrals, home-based care services, and pre-admission screenings for individuals seeking long-term care services either at home or in long-term care facilities. Camden has an MS in Administration of Human Services and is a certified volunteer administrator. Camden, would you join us on camera and share a little more about your organization?
Thank you, Allegra. Good afternoon, everyone. Thanks so much for having me today. I am the supervisor for the Northern Virginia Long-Term Care Ombudsman Program, and I'm happy to share a little bit more about what we do. Next slide, please. So what is a long-term care ombudsman? Simply put, we are a resident-directed representative, and we advocate for the highest quality of life and care for people receiving long-term care services. And I really just want to focus on that resident-directed piece of what we do. Our primary role is to really represent the residents' interest, not necessarily the government or the state's interest when we're doing our work. You know, we want to prioritize the residents' wishes and their concerns, and they are our boss. So we cannot proceed without their permission before we do any sort of advocacy. And we just want to make sure that their honors and their choices and preferences are being honored. Next slide, please. So I'll tell you a little bit about the structure of the program here in Northern Virginia, but I wanted to start and share a little bit of information about the Ombudsman program within the state of Virginia. Across Virginia, we have 19 long-term care ombudsman program regional offices for a total of 32 local ombudsmen that staff those offices. In the state of Virginia, we have 857 facilities, and that's a combination of both assisted and nursing. We have 5 hospital long-term care units, and that's over 70,000 residents being served by the Ombudsman program throughout the state. For our local office here in Northern Virginia, even though we are housed within the Fairfax County Area Agency on Aging, we are a regional program. So in addition to Fairfax County, we also serve Arlington and Loudoun counties, as well as the cities of Alexandria, Fairfax, and Falls Church. Our regional program provides oversight to 148 long-term care facilities, which is about 12,747 licensed beds. In the state of Virginia, we also advocate for long-term care consumers that are receiving community-based long-term care services, such as home health, hospice, and adult day health care. This varies state by state, but in Virginia, we are allowed to advocate for those individuals as well. Next slide, please. So this is just a brief
Camden, I'm
over.
so sorry. Would you mind maybe moving your microphone just a little? It's coming in a little loud, and so it might be cutting off. There we go. Maybe that'll work.
Does that sound better?
Yeah, yeah.
Okay. So this is just a brief list of some of the services that we provide. So we have an intake line where people can give us a call, and this is probably a majority of what we do. We do a lot of information and assistance for consumers, residents, family members, people calling from the community. They may be calling with questions about long-term care. They may be calling to get information about specific facilities, but we also get a lot of calls about issues and concerns with their care. And so, depending on what they're having an issue with their permission, we can get involved. We call it opening a case, doing an investigation, where we try to resolve that concern to the resident's satisfaction. We can either do this on an individual basis, or we can do it systemically for an issue that may be affecting multiple residents within a facility. We also do a lot of community outreach and education, much like today's panel, about our program, residents' rights, and other long-term care issues. We also have a very robust volunteer program. We have 30 volunteer ombudsmen right now. Our volunteers are very critical to our program. We only have 7 staff here for Northern Virginia. And as I had mentioned on the previous slide, we had 148 facilities. So our volunteers really do allow us to extend our advocacy efforts and do provide a more frequent access to an advocate. Our volunteers are trained and certified, just like the ombudsman staff. They are assigned to visit a specific facility, and they go every week for about 4 hours a week. So because they're boots on the ground and they're there so frequently, they are able to really develop working relationships, not just with facility staff, but effective relationships with the residents as well. We also help support the development of family and resident councils. We want to make sure that residents and families are aware of these councils, and if they are not happening in specific facilities, we can help them to form those councils and help them get the support of the facility to make sure those councils are going to be happening. And then our staff also provides visits, much like our volunteers. Although we can't get out there as frequently, we do try to get to all of our facilities at least once a quarter. Next slide, please. And last but not least, this is our contact information. Like I mentioned before, we're located in the Fairfax Area Agency on Aging. This is our address. We also have our intake line there highlighted. We also have our email address. Those are the 2 primary ways that I would recommend people get a hold of us, unless they run into us while we're making a facility visit. We also have our website there. There's lots of good resources on our website about long-term care services, tips for advocates, and more information about what we do. Thank you.
Thank you so much, Camden. Really appreciate you. I'm going to introduce our next panelist and share about her. We have Denise Chadwick Wright. And Denise is a dedicated advocate for the senior members and communities to have access to quality care that respects and protects personal dignity. This lifelong passion has led to a successful career as a respected leader of over 25 years within the senior healthcare sector. She developed a deep expertise and invaluable insights from a formative career as a licensing nursing home administrator working across multiple states. Extensive experience gained from leading businesses' agendas spanning the organizational life cycle, from startup through the delivering successful turnaround, have equipped Denise with a sharp eye for what it takes to embed operational excellence and create a culture of high performance. Led a 42% plus profit in first year, surpassing an 18% projected loss for fledgling startup. Denise is recognized by her peers as a tenacious leader who marries the strength of strategic thinking with proven business acumen to build healthy and effective teams and sustainably successful organizations. She was awarded the prestigious American College of Healthcare Administrators Facility a Leadership Award in recognition of organizational leadership. Most recently received the Woman Distinction Award from McKnight Senior Living and has been inducted into the McKnight's Woman of Distinction Hall of Honor 2021. She is committed to the continued sustainability of healthcare sector and serves currently as a VHCAV-CAL, not-for-profit board member, AHCANCAL, not-for-profit council member, and the chair of the Human Services Alliance of Greater Prince William Board. She has served as an advisory board member for the University of Richmond Customer Service Program and has served as an adjacent faculty member for the Healthcare and Business Administration undergraduate students at Stratford University Falls Church campus. Denise holds a Master's of Business Administration with a concentration in Health Administration from Eastern University and a BS in Business Administration from Indiana University of Pennsylvania. Denise, thank you so much for sharing your expertise with us today. Can you come join us on camera and unmute and share more about your organization? Thank you. And can you unmute for us, Denise? I think you're still, there we go.
Yes, thank you, Allegra. I'm delighted to be a part of today's panel. Birmingham Green is situated on a 54-acre campus located in Manassas, Virginia, which is what is on the screen currently. Our story starts back in 1918 when the plan for the district home was written into the laws of Virginia to create a home where low-income, frail, and elderly people could come live and thrive. Next slide. We have a private-public partnership with 5 local Northern Virginia counties. Our partnership is with Fairfax County, Fauquier County, Loudoun County, the city of Alexandria, and Prince William County, which is where we're located. Next slide. We have the capacity to serve a maximum of 308 residents per day across our campus. This slide is showing where it all began, the district home, which was constructed in 1927. We are able to provide comfortably care for 30 residents in this setting. We have respite stays available here, as well as we have rehabilitation services available if needed in the assisted living home here. And this is a dormitory style setting, but it's very affordable, about $4,800 a month. It's a private setting, private pay setting, although we do have a few auxiliary grant beds. Next slide. This is our nursing home. And in our nursing home, we're dually licensed with Medicare and Medicaid to provide services to 180 residents per day. We have wellness services. We have a team of medical staff. We have a medical director. We have wound care specialties, psychiatry and psychology services. Wound care services also are provided here, and rehabilitation. We're able to provide hospice services as well. And we offer short-term as well as long-term care here in our nursing home. Next slide. This is Willow Oaks. Willow Oaks is an assisted living building. Here we are licensed to provide services to, we have 92 units here, and we provide assisted living services as well as we have rehabilitation services that are available in this setting as well. And this building is 100% auxiliary grant funded. So the residents have to meet the qualifications for the auxiliary grant here in Virginia. And we have here 15 units dedicated for residents under the age of 62 with disabilities, and then the remaining 77 units were for those over the age of 62. Next slide. This is a slide showing some of our residents here, and it's showing how when we look at our vision, a Northern Virginia partner since 1927, believing in dignity for everyone, going beyond just the wellness and the clinical services. We engage our residents. We have a focus on preventing social isolation. Here you see them utilizing technology. We have weekly technology classes. We also have farm to table. So we have a microgreen farm on site. And then we also have a fall balance prevention program that's part of our rehabilitation services program. So this is showing you how our residents thrive in our environment. Next slide. We offer volunteer opportunities here. We have volunteers with different youth groups, but we also partner with learning opportunities with local vocational and colleges for clinical rotations. And we also have a CNA program. So these are opportunities for volunteering, engaging the community and the services we provide, as well as our residents are involved in volunteer opportunities as well. So you see our garden outside. Next slide. So ways that you can support us. So we have here ways that you can support us, and all of this information is on our website. There's a book that was written, Didn't Meet Any Geezers. The goal is for it to introduce youth to long-term care services. There are multiple services outside of just clinical services, as far as career opportunities where people can work in this setting, hospitality, finance, operations, as well as getting people accustomed and used to long-term care, because there are a lot of misconceptions of long-term care. So next slide. Here's just some resources available for caregivers. And our last slide has our contact information, our admissions team here, my information, and our website and main numbers for both of our buildings. So Birmingham Green, we're a great place to live, a great place to learn, a great place to work, and a great place to be. So we employ about 350 professional team members across our campus that allow us to continue to fulfill the mission of our organization, which is a community with a holistic approach, fostering the spirit, nurturing the body, and nourishing the mind. Thank you.
Thank you so much, Denise. Really appreciate you. And now I'm going to introduce our next speaker, our panelist, who is Kristin Martin. She is a social worker and manager of case management with the Inova ElderLink team. With over 15 years of professional experience in the field of aging, Kristin has been a champion and advocate throughout Fairfax County for older adults and family caregivers through her leadership and variety of supportive services, including the facilitation of evidence-based health and wellness classes. Kristin is a certified case manager and received her Master's of Health Science with a concentration in gerontology and Master's of Social Work from George Mason University. Kristin, thank you so much for joining us today and being on our panel. Can you join me on camera and share more about your organization?
Great. Thanks so much, Allegra, and good afternoon, everyone. So ElderLink is part of a long-standing 30-year public-private partnership between Inova and the Fairfax Area Agency on Aging. And ElderLink was initially established to help address a gap in services for those who may not qualify for support due to income guidelines through federally mandated programs that offer free assistance. So when ElderLink was created, it was originally designed to offer affordable case management services to older adults 60 years of age or older who were experiencing cognitive impairment, as well as to their caregivers, regardless of income. And while that case management really remains the heart of what we do, and it's the foundation of ElderLink services, our program has expanded over the years, and we now administer a variety of supportive services and programming on behalf of the Fairfax Area Agency on Aging. We provide services for older adults and their caregivers throughout Fairfax County, as well in the cities of Falls Church and Fairfax. And we truly aim to support all family caregivers. So that would include spousal caregivers, as well as adult children and other family members who are involved in a loved one's care. We also recognize that friends and neighbors who may not as readily identify as caregivers play an important role in caregiving as well. So truly, we are here to support all caregivers. Next slide, please. Our mission is to support the safety and independence of older adults living at home, as long as that remains the safest plan of care, as well as to support family caregivers on their caregiving journey. And this mission helps to guide the wide variety of caregiver support programming that we offer to the community. Next slide. So some of our program highlights include caregiver support, case management or care coordination, in-home bathing and respite support, as well as evidence-based health and wellness workshops related to chronic disease self-management and fall prevention classes.
Thank you so much, Kristin. Thank you, thank you. Well, folks, we're going to now start our panel conversation. I'm going to bring on the panelists and ask them a few questions. And while I'm doing this, if you have questions, you can now put them in the Q&A box. Towards the end of my questions, I'll bring in your questions and we'll try to get to as much as we can. But I would like to start with Denise. Denise, if you can come back on camera with me and unmute, I'm going to open up our conversation with you. My first question is, what are the key signs that indicate if a loved one might need a higher level of care? What should family members be looking for? And one other thing, Denise, what is a higher level of care? Well, how would you, just to start off, what is higher
Sure.
level of care? And then how do you then know what to do?
So when I think higher level of care, I think about something beyond what the person at their baseline would typically be receiving. So for example, if someone is in a home setting and they're able to function independently, a higher level of care would be if they need assistance or support in the home, whether it's support with meals, housekeeping, things of that nature. And then it goes up from there, whether it's home health services, whether it's going into another setting such as assisted living or a nursing home. That's how I view and define higher level of care. So there are a few indicators when I think about key signs that a loved one may need a higher level of care. And some may be clearer than others because if you don't live close or visit often with your loved one, it may be more difficult to detect if they're not comfortable with sharing that because they're worried they may be a burden or they're not accepting of changes that may be happening. So there could be safety indicators such as they may be forgetting to turn off appliances. So the stove may be left on. I know I had a personal encounter with a loved one leaving a tea kettle on and it burned up. Forgetting how to turn off appliances could be a concern. People may start wandering or getting lost. If they're still driving, they could be forgetting how to get to places they normally or easily will be able to get to. It could be more dings in the vehicle or increased traffic violations, things of that nature. Even handling bills, not being able to open the mail, handle paying bills, mismanagement of medications, also not taking medications as prescribed, and that perhaps could be seen with piles of medication, or if they use pill boxes, pills still being in the box when they should have been taken based off the day. It could be physical indicators where They may be declining in their ability to walk around, get around, to dress themselves. So you may see them wearing the same clothing or soiled clothing. And that could also be concerns with not being able to do laundry anymore. There may be slight odors because they can't do their personal hygiene the way they once did. And so they may need home modifications, that would be able to assist them with that. And then it could be increased clutter in the home if the person was very organized. Also, you can look at the animals. If your loved ones have animals, you can look at how the animals are cared for. Or are they not cared for the way they once were, matted, their weight changes, or no food or water in the bowls, things of that nature. It also could be emotional indicators, so change in mood, being withdrawn, antisocial. If they were once a social butterfly, enjoying going out to events, they may not do that anymore for different reasons. And then it could be cognitive indicators, memory loss. And sometimes the memory loss could be temporary because it could be due to changes in medications. They could have impact or effect on their cognition temporarily. And I've also experienced that with my mother recently. And that was scary because I live a few hours from my parents. So if you don't have people that can check on them, some people aren't open to having Alexa or different devices in the home so you can physically see what's happening. But I do know they've been helpful. I have a neighbor who her children have placed some security cameras in places that the person would normally go, such as the kitchen, things of that nature.
Thank you so much, Denise. That was a great list of things for us to keep our eye out. Well, I will let you go off camera for right now, and I'll come back to you. And Kristin, if you can come join me on camera and unmute. And Kristin, my question to you is, what are some of the common challenges that family caregivers face when deciding they need a higher level of care?
Sure. So, deciding on a higher level of care is a decision that has a lot of different layers with a lot of factors that come into play. And no matter the decision made, there's going to be a ripple effect to that decision. So some of the challenges that a caregiver may need to think through include practical considerations, such as first knowing what options are even out there, and then evaluating the different options identified to figure out as best you can what might be the right fit for you. There are also financial considerations of paying for the cost of care versus needing to forecast the ramifications of potentially needing to leave the workforce to provide care. And then the emotional considerations. There are a lot of difficult feelings that can come into play when trying to make this decision. So there might be the sense of loss as you see your loved one declining to the point of needing more care than what you can realistically provide. Maybe some guilt over even considering the possibility of your loved one going into or needing a higher level of care, as well as fear of the unknown. With not knowing how things may play out with the decision that's being made. Family dynamics can certainly be another barrier, particularly if other family members are not all in agreement, which can create yet another level of stress and anxiety. There's no crystal ball when it comes to caregiving, and caregivers are often in the position of needing to pivot and then reevaluate as we deal with what often feels like a moving target. So I do want to mention that it's really important that caregivers are willing to give themselves the gift of grace when making these difficult decisions. And you need to trust that you are making the best decision for your loved one based on the circumstances of your particular situation, with the acknowledgement that we might miss the mark sometimes. And that's where caregiver resilience can really shine through, with figuring out what we can proactively do to then address the situation.
Thank you so much for that insight, Kristin. Thank you. Thank you. Camden, can you come join me on camera and unmute as well? And my question to you is, what should caregivers know about advocating for their loved ones' rights and quality of care in a long-term care facility?
So I think that probably the first thing they should be aware of is that when folks enter into a facility, they actually gain rights. A lot of people think that they lose rights when they enter into facility, and that's not true. There is a thing called residence rights. Both assisted living and nursing facilities have them. They are part of their regulations. They're also inscribed in Virginia State Code. So I would encourage them to learn about those rights, figure out what those are. That's probably first and foremost what I would recommend families know about, advocating for their loved ones' rights and quality of care. Within those rights, residents have the right to participate in planning their care, and they can involve their family members and their personal caregivers in that as well. And I think that's really important for anyone who's going into a facility to be an active member of the planning of their care, and especially their family members that are going to be involved and are going to be making the visits and are going to be there day to day. We want to make sure that the facilities are aware of what the residents want. What are their choices? What are their preferences? Some people like to get their bath in the morning. Some people like to take a shower at night. Those little things make a big difference. So we want to make sure that they know about that. And a good way to do that is to get to know staff, ensure there's open communication with staff when you're making your visits as a family to see your loved one, attend care plan meetings if you can, so you can get those updates on what's going on with their care. Visit often. I would also want family members to know about the facility's grievance procedures, because as ombudsman, we do make visit, but we're not there 24/7, and things are going to go awry when we're not around to assist. So we would want family members to know about the specific grievance procedure within a facility so that they know who to go to, where to go to lodge a concern if they have one. And then another way for families to get involved is to participate in the family council if their facility has one. That's a meeting that is for families of the residents in the facility. It's a place for them to come together and support one another and talk about issues that may be going on in the facility, and to effectively work with the facility staff to make sure they're providing quality of care.
Thank you so much, Camden. I'll come back to you. But Denise, can I have you join me again on camera? And my question to you, Denise, is how do family caregivers prepare financially and emotionally for this transition of higher care?
I would say the first step is communicating. So talking about services and possible needs before the the person needs the services. I think that's important. A lot of times we don't want to have these conversations, but they're necessary, because anything can happen to any of us, not even just elderly people, any of us. So planning starts before they need the services, knowing what's out there, knowing what resources are available, having conversations where they can express their wishes, and then after the conversations, taking action to put things in writing. So whether you work with a legal representative or go to a local area agency for aging to provide you with resources and support to put power of attorneys and advance directives in place, and have your wishes in the event you're unable to make those decisions identified. And I think, those emotionally, we all know at some point we're going to get older. We're all aging daily, and we all know at some point we're going to die. So, and even when it happens, we all handle things differently. So being open to communication, I think will help lessen that experience. But I don't know if totally you could ever be prepared. It's something that you have to deal with, but I think you'll be definitely better equipped to make decisions and know where resources are you can go to, because there are plenty of resources available in the different areas, your cities, local governments that people aren't familiar with. And when you're in that state, you may be a little frazzled. So if you have that together beforehand, and then financially, um, if you're able to invest in long-term care insurance, that's helpful. Thinking about your retirement plans, thinking about your home situation, how it's set up. Is it the home that you plan to live in for as long as you can? So making sure your home is set up for as you age. If you need to stay on if you have two levels on one level, that you have everything you need on that one level, or is set up with modifications to allow you to live there as long as possible, independently, or things that you could start doing and thinking about in advance. I hope I answered the question.
You did, you did. Thank
Mhm.
you so much, Denise. Thank you. Kristen, can you come join me again? And can you share some resources or support systems available through ElderLink that can assist the caregivers during this transition?
Sure, yeah. So as I briefly shared earlier, ElderLink offers a wide variety of services truly aimed at supporting family caregivers. So one of the services that we offer are called caregiver consultations, which are offered at no charge. And these 60-minute consultations offer space for a caregiver to talk about their caregiving situation with an ElderLink case manager. And then after listening to the caregiver's story, our team provides guidance and resources for the caregiver to consider, which are tailored to their unique situation. And while Fairfax County is a great place to grow older, as Denise was alluding to, it sometimes can be a little challenging to learn about the available programs and the care options. And navigating that caregiving journey is especially challenging for caregivers who are new to this role or when there's a change in the caregiving situation. So this is where a caregiver consultation can be a huge help in providing some guidance. And caregivers can request a caregiver consultation by calling our ElderLink intake line, 703-324-5374. We also offer a virtual support group that is accessed from the comfort of home. So these calls are scheduled the second Tuesday of each month from 7 to 8 via Microsoft Teams. And each month focuses on a different topic, and caregivers can register to participate in all the calls or maybe only the calls that are of most interest to them. No income requirements, no fee to participate. And regardless of the topic itself, support groups are a wonderful way for caregivers to forge connections with one another. So that ability to interact and engage with others who are going through a similar experience, both the challenges and the joys, can be such an important source of moral support and emotional comfort as well. Support groups can also offer a wealth of information through the sharing of resources and tips that occur. We also help to administer two types of in-home care respite programs. So we have our traditional respite and volunteer respite as well, which for some caregivers could be a form of a higher level of care if there's no outside support currently coming into the home. So the goal of both of these programs is to provide a temporary break to the primary caregiver who is residing and caring for an older adult loved one who would be unsafe if left home alone. And that might be to a cognitive issue, such as some form of dementia, or maybe they have a high degree of physical dependency. With the traditional respite, we have certain functional and financial requirements that must be met to qualify. And that includes having a full-time unemployed family caregiver, which means that caring for a loved one is the full-time focus. If those eligibility requirements are met, then a licensed home care aide can provide up to 6 hours per week of in-home assistance with personal care, companionship, and supervision. So during that time that the aide is at the home, the caregiver can feel free to go out or even go in another room and just shut the door for a little while. And that traditional respite program operates on a sliding fee scale. The volunteer respite program matches a trained volunteer to provide up to 6 hours per month of in-home companionship and supervision only. So personal care is not provided through this program. And although functional eligibility requirements must be met to qualify, there are no income requirements and no fee for service. Case management is yet another option for support. So through this program, a biopsychosocial assessment is completed in the home. And this is to help determine what's working well, and then what are the other areas where some additional support might be beneficial. And then based on that assessment, as well as the goals and preferences shared, an individualized care plan is developed to meet the needs that have been identified. So in addition to the assessment and the development of the care plan, case management is also able to provide ongoing monitoring, family support, referrals and assistance with getting services in place, as well as responding to changes in the needs of the client. And case management is a fee for service, and it's offered on a month-to-month basis. The last I'm going to mention is a workshop for caregivers called Caring for You, Caring for Me. And this is a 5-week workshop that meets once a week for 2 hours. Caring for You, Caring for Me is a blend of support and education for family caregivers, focusing on advocacy and care for both the caregiver and the care recipient. And it's actually the signature program of the Rosalind Carter Institute for Caregivers and was created to support caregivers, so helping them to cultivate relationships and develop skills that research has demonstrated to be the most beneficial to both caregivers and the care recipient.
Lots of resources. Thank you so much for sharing that, Kristin. Camden, could you join me again? And I wanted to know, are there any specific steps or checklists that you recommend for caregivers to follow when evaluating what potential care facilities that they're looking into or services that they're looking into?
Sure. So I think probably where most people start when they're first looking to at a facility or trying to figure out what type of long-term care service they is available for their loved one, they go online. And that's a great place to start. What I would say, just sort of this, note of caution, is when you are looking up specific facilities, home health agencies, whatever it may be, you're going to see a lot of online reviews. Really, please take those with a grain of salt, because those aren't a true indicator of the quality of the service that agency or facility may provide. One of the websites that we really encourage people to go to when they're looking, either it's doing a general search or maybe a more specific search if they've narrowed down what kind of service or what type of facility they want their loved one to go to, would be the licensing websites for each type of facility. So for assisted living, that would be the Virginia Department of Social Services. You can go on their website, you can type in assisted living, you can do a search based on zip code and find various facilities within your area. And through that website, you can see what kind of license they have, who the licensing inspector is. It has all of the inspection reports, so you can get an idea of what's going on in that facility. Were they cited for any violations? What were they? What were the actions that they took to resolve those violations? And it's the same for nursing home, except that you would go to the Virginia Department of Health website or Medicare.gov. They both also have that same search engine where you can type in your zip code or certain area and it'll bring up a different list of facilities. Virginia Department of Health, you can also find information on there about home health, hospice as well. If a caregiver has narrowed it down to a handful of facilities, they can also call us, and we can provide them some aggregate kind of high-level data on maybe any issues or concerns that we've addressed or looked into over the past year at that specific facility or home health agency, if that's what they're looking for. We also encourage them to make multiple visits to each facility, different times of the day, different days of the week, to get a better idea of what it looks like at that specific facility. And just to when they're there and they're making those visits and they're doing those tours and they're speaking to staff, really sort of put themselves in their loved one's position, the resident's position, and ask themselves, what would they want? What would they need from this facility or long-term care service? And then our website is also chock full of good information. We have a a worksheet on there called Tips for Advocates. And it has, I mean, if it has 10 questions, it has 30 questions or different things to either ask or look for when you're in a facility. Another good resource would be the National Consumer Voice. They're a national advocacy program for long-term care recipients, and they have some very good fact sheets on their website too about questions to ask facilities and other long-term care service providers.
Terrific. Thank you so, so much, Camden. Denise, can I have you join me again? And I have a question about misconceptions. What do you see as some misconceptions that family caregivers may encounter about higher levels of care?
I think some misconceptions are specifically for nursing homes smell. There isn't adequate staff to provide services. Residents are sedated. Some people even think married couples can't share a room. Um, all residents don't have memory cognitive impairments. There are other reasons and needs for them being in that type of setting. Um, I think a lot of times I hear people talk about abuse and assume that abuse is something that could take place. There's no privacy. Residents, their rights aren't there. They can't make decisions, and those are misconceptions. They're not true. Um, and some people see nursing homes as doom and gloom, but some people actually they come to a nursing home, and if they have a place to go after the nursing home, they do return, whether it's return home or to another setting. So it doesn't have to be the last place where you are.
So helpful. Thank you so much,
And
Denise.
also, oh,
Yeah, yeah.
bingo. Bingo is the only activity. Although
No.
it may be one of the favorites, there is so much more to life enrichment services that take place in assisted living and nursing home settings.
More than just bingo.
More than in bingo, yes. Giving residents a sense of purpose. Yep.
Thank you, Denise. Thank you. Kristin, can you join me again? And my question to you is, what advice would you give to the caregivers who are hesitant or who are struggling with making this decision? I know we talked about the common challenges earlier, but now what would you say to them? What is the advice?
So I would say that the hesitancy and internal struggle that a caregiver may be dealing with in deciding to move forward or not with a higher level of care is absolutely normal. On the flip side, it can be very easy for someone not as intimately involved in the caregiving situation. So it could be a medical or social service professional, maybe a well-meaning family member or friend, to look in on that caregiving situation and very strongly assert what you should do. And while that strong assertion is really intended to look out for the well-being of the caregiver is usually thinking about the well-being of their loved one and how their loved one would be impacted by any type of transition. So when faced with a big decision, it can really help to more systematically think through the decision by actually putting pen to paper and creating a pros and cons list. So, should I transition my loved one into a higher level of care? That might be the question that you're trying to answer. And then you would proceed by making a pros column and a cons column, really trying to think through all the perceived negatives and positives that are, popping into your mind. And after you have a chance to get all of those thoughts out, you're going to review each of the reasons and score them on a 5-point scale, with a score of 5 meaning very important consideration to you, and a score of 1 meaning still consideration, but not really a make or break point. And after you scored each of the reasons on the pros and the cons column, you're going to tally the scores and objectively see which column has the higher score. So not that the scores alone are going to make your decision for you, but it is a helpful exercise if you are feeling uncertainty about a decision, as it can help guide you through the insight that you're gaining. I would also share that in general, transitions usually take about 3 months before things start to settle. So to be realistic in giving both you and your loved one time to adjust, if moving into a higher level of care or even bringing additional care into the home. And finally, although your loved one may have transitioned into a higher level of care, that does not mean that your caregiving stops at the door. So the difference is that a caregiver is now more able to engage in quality time with their loved one instead of quantity of time doing different tasks. And that transition into a higher level of care may allow for that caregiver care recipient relationship to transition back to the spousal relationship or adult child parent relationship. But really, no matter the decision that's made, a caregiver must keep in mind the importance of self-care. And self-care is an essential part of any healthy caregiving relationship. And, rationally, we know that it's true, but it's often difficult for a caregiver to make that a priority for themselves. But truly, caregiver self-care is a preventive action that a caregiver can take in helping to sustain themselves during the caregiving journey. And by taking the time and making the effort to engage in self-care, and that's going to look a little different for everyone, but you're going to be a stronger caregiver and you're going to be a healthier caregiver and in a better position to continue supporting your loved one.
Thank you so much for your advice, Kristin, and stay online. You can stay on camera. I'm going to have everybody join us now. So if I can have all the panelists coming back on, thank you. And at this point, I am going to, again, open up the floor to our audience to ask some questions. I know we have some questions that have been already coming in, so let's address some of those. And any panelist may answer this, so feel free to come off mute for this one. A question is there a checklist available to help guide me in obtaining the legal documents that as a caregiver that they need to make sure they're equipped with to care for my husband who has dementia?
I want to say, oh, sorry, Camden.
Oh, I was just going to briefly mention on our website, we do have a link that just discusses the different types of power of attorney, but we are by no means legal experts. We do not provide legal guidance. We would probably encourage someone to reach out to an attorney or perhaps Legal Services of Northern Virginia, which is local to our area, to help sort of navigate what legal documents might be necessary for that individual.
Yeah, no, it's a great question because, you're in the position of not knowing or you don't know what you don't know. And certainly, we want to prevent as much as possible the need to reinvent the wheel when it comes to figuring out what might need to be obtained. Excellent suggestions by Camden. I would also suggest the Alzheimer's Association might be a helpful resource. They have a wealth of information on their website that really pertains to financial, legal, a bunch of different topics. So that would might be a good suggestion to check out as well.
Also, you can call the Fairfax Area Agency on Aging. Give us a call. Here in our caregiver unit, we produce webinars that talk about, we bring in legal experts and we bring in financial experts. And so we do have some handouts. So I'm more than happy. Send us an email, give us a call, and we can try to connect you. And what the ladies shared too are great resources, but more than happy to try to connect you with those. Camden, a question came in directly for you.
Okay.
How does a resident or a family track the status of reporting?
Okay, so I'm going to assume this question is reporting to our program because it would vary, I think, across programs. So folks will call us, or we might run into them at a facility and they bring up an issue or situation and they've given us permission to get involved, whether it's the resident directly or if the resident isn't able to give us that permission, perhaps a family member can do that. And then we just work with them. We work with them and the facility staff to help resolve that issue. There is no formal computerized tracking system that they can access or anything like that, but we work very closely together with our family members. I mean, almost every resident that we work with has a family member involved. Not all of them do, but most of them do. And so we work very closely with them as we're doing our advocacy work and keep them updated and keep them apprised as to what is happening.
Thank you. Another question came in for you too, Camden. Is the Ombudsman As ombudsman, are you self-mandated reporters then?
Excellent question, and a controversial one.
Mhm.
No. So, short answer is no. Ombudsmen are not mandated reporters. So, within the state of Virginia, as a social worker, I am a mandated reporter. I am engaged in one of those professions that is mandated by the state. However, the Ombudsman program is a federal program that's mandated through the Older Americans Act. So, the federal rule that governs the policies and procedures of our program states that we do not report to Adult Protective Services. So therefore, that federal law trumps state law. And it really goes back to the resident direction piece of our program, where the resident gives us permission to get involved. And we are there to represent their interests, not necessarily the interest of the government or the state. We're there to resolve issues to their satisfaction. And there is a big fear of retaliation by residents and even family members who call us with issues, who are hesitant to get us involved or hesitant to give us permission to let someone on staff know that there's a suspicion of abuse or neglect. So we just try to work through it with the resident, with their family members, with their caregivers, to hopefully at some point get that information to the people that need it. But that's sort of a long way of just saying, no, we are not mandated reporters, as long as we are acting in the capacity as an ombudsman.
Thank you so much. Um, whoever would like to answer this, or all of you, whoever, but the next question is, are there resources available for a bedridden mid-50-year-old with no financial resources who needs nursing care?
I would say yes. So Medicaid is based off of income levels, and based off the cure levels. So I would say yes. The first thing would be for assessment to be conducted, completed to determine the level of care needed for that individual. And if they have no resources, it sounds like they would qualify for Medicaid. So they can reach out to a local, I guess, wherever they reside, the county, the Medicaid office, to get support, and that's, about what's available. But the first step would be to get an assessment to determine what the level of care is.
Perfect. Thank you so much, Denise. Camden, Kristin, did you have anything else to add, or no? Okay, perfect. My next question is, how can we help convince a loved one to join a nursing home or assisted living facility if they're worried they won't be taken care of due to stories of neglect and short staff issues in such places? Also, someone also said, are there facilities such as Miss Wright's that are grant funded that don't have a problem with being short staffed? I know there's like two questions in one there, but if anyone wants to take a stab at that.
So I'll take a stab. So the first question was, can you repeat that again? So,
Of course. The first part of it is, how do we convince a loved one to join a
okay.
nursing home or assisted living if they're worried they're not going to be taken care of due to the stories of
Okay.
neglect and short staffing issues in such places?
Yeah.
And this is kind of what we spoke to earlier,
Right.
those misconceptions. And I
Correct.
think it's just everybody's like, I'd never take me to a nursing home. It's just such a thing that you hear. But yeah, how do you convince somebody or
Well, first, I have two thoughts. One, I'm thinking, so do they have to go to a different setting, or can they stay in the setting they are with support services? If not, then I would say I would encourage to take them there for a visit. Most facilities, they when people want to come and experience how it is to stay there, they probably would allow them to stay for a meal, to experience, interact with other residents, to walk around, maybe to even go to an activity or event that's being held at the facility. And then there is a checklist on the CMS website that gives a listing of items to look for when picking a nursing care facility, but it could also probably be used for assisted living as well. So I think it's really the mindset. Everywhere there are challenges, and then it's what is the person considering short staff, right? So if you're thinking you're going to have one person assigned to care for you 24 hours a day, I guess it depends on the setting. It may be settings where that's available, but in settings typically Medicaid, Medicare, even some private pay settings, they don't have one staff person dedicated. So I think it's really understanding what the person's expectations are, I think is the first part, and then visiting. And then something was about the grant program, if
Yes,
it's
so the
this.
second part is, are there facilities such as Ms. Wright's at Birmingham Green that are grant funded that don't have the problem of being short-staffed is that other part to that.
So I will say, I'm sure there are other places that accept, I don't know if they're talking about the auxiliary grant specifically in assisted living. I know there aren't many, if any, that are 100% all auxiliary grant, but most facilities, when they're being built, they have to have X amount of, I believe, auxiliary grant beds. But as far as staffing, going back to that again, I think it is important to look at staffing levels, to look at the complementary of staff. Um, it's a combination, not just clinical staff, but the other support staff and the model that's in place to provide services with dining, EVS, life enrichment, social services, things of that nature. But the other thing I would say is that when you go in McDonald's now, Walmart, you see all of these automated checkouts, the supermarket. So, when we talk about the workforce, a lot of things changed since COVID, right? And so, and staffing is a challenge. It's a national challenge, which is why we're trying to encourage young people, make them aware about nursing, get into the field, because we are at the stage basically where the baby boomers, the largest population, right? 2030 in the United States, but we're seeing that. So I would, say, you could look at staffing levels, CMS compare. You could compare facilities and look at what's happening operationally from citations, surveys it has on their staffing component for CMS compare. So you could compare and see if it meets your needs. And then, it's nothing like visiting, as I think someone else recommended, doing off shifts to see, different shifts, like how are they staffed? What's happening in the environment. So that's
Thank
my
you.
input.
Thank you so much, Denise. Another question, ladies, is what is an auxiliary grant? For someone who has no idea what this terminology is, can one of you explain that?
So it's a type of Medicaid specifically designed for assisted living. So it's similar to screening for long-term care Medicaid when we're thinking of nursing home level of care. But a social worker from adult services specific to the region where the individual resides would need to come out to the home to do a screening to see if a person qualifies for assisted living level of care. And then there's also a financial component. So there is a certain monthly maximum income in order to qualify, and resources are also considered as well.
Yes, Camden. Camden, you're on mute though. There we go. That's it.
I was just going to add to that. I was working on another presentation today, and we were talking about auxiliary grant. So Kristin had mentioned that there is an income component to it. So for the Northern Virginia area, for someone who would be qualifying for the auxiliary grant, who's looking to go into an assisted living, because it is only good for assisted living, your gross income must be at or below $2,418 in the Northern Virginia area. For the rest of Virginia, it's $2,103, and that's gross income, not net.
And so this auxiliary grant then is used to help pay for an assisted living bed. And like Denise mentioned, most facilities do have to have a few beds available to use the grant. Is that correct?
It depends.
Okay.
That's like the answer to most questions, right? It depends. Yes, it depends on the locality. So certain localities within our area and across the state do have requirements of assisted living facilities to set aside a certain percentage of their beds to be auxiliary grant beds. It's usually a very small number. It's really a very hard bed to find. A lot of facilities just don't offer them. In our area, a lot of the local jurisdictions do have a certain percentage, but again, it would vary from like Fairfax, Arlington, Alexandria. You would want to inquire with the locality in which you're living to determine. And again, not every assisted living facility is going to have an auxiliary grant bed available.
And it sounds like it could be competitive because there's just not that many. Is that correct?
Yes, there's often a wait list.
Mhm.
I also wanted to share that there are two subsidized assisted living facilities in Fairfax County. So someone had asked a question about other facilities that might, I think, offer slightly lower or more affordable rates. So there's the Lincolnia and then Braddock Glen Assisted Living within Fairfax County
And then I think Culpeper Gardens in
as well.
Arlington. Mhm. But if the person who asked about auxiliary grant, I'm looking, they could go to uh, www.dss.virginia.gov and then put in their search regarding auxiliary grant. This information there.
Terrific. Denise, while you're unmuted, I have a question for you. Earlier when you spoke, you mentioned the CMS website. An audience member wanted to know, what is CMS? What does that stand
Okay.
for?
Centers for Medicare and Medicaid. So for nursing homes, we're under federal and state regulatory requirements. So, but there you can find information outside of nursing homes, hospitals, anyone receiving federal funding. You can get information there.
Perfect. Thank you. Another question I have from the audience is, are there licensed small group homes that provide nursing care?
I'll take this one or start it at least. So in Arlington County, there are actually, I think, 2 or 3 group homes that are also licensed as an assisted living. And I think they have anywhere from like 8 to 12 beds. But we have a lot of what we call 8-bed facilities. They're usually assisted living. They're smaller facilities. They're usually set up in a house in a neighborhood. Like you could be driving through the neighborhood and have no idea that the house you just passed is technically licensed as an assisted living. We call them the small 8 beds. And so I'm not sure if that's what this person is referring to, but there are,
Nursing home care, Camden. Do any
oh,
of them
nursing
do
home
nursing
care.
home
No,
care?
just assisted living.
Okay, so group home care really does, the level of care ends at assisted living, is that correct? And it does
Well, so
not
not
go.
every group home is licensed as an assisted living. There's an exception in Arlington. They have a handful that are. Most group homes are licensed separately through the Department of Behavioral Health. It's a different type of care.
Got it. And then, but you're saying that some of them are created for assisted living environments, though.
They're licensed
They're
as an assisted
licensed
living.
as an
Most of
assisted
them are
living,
not.
but most of them are not.
If you have
Okay.
a small 8-bed facility, it's typically licensed as assisted. I personally have not seen a smaller 8-bed nursing facility. That's not to say they maybe don't exist across the country, but we don't have any within the Northern Virginia area.
Is there a benefit, or do you all recommend looking at these smaller group home assisted livings versus a bigger facility? Is there any pros or cons when looking at that?
I would say it's based off the individual needs. So I had a loved one who lived in the District of Columbia, and so she was the caregiver spouse, and she had her spouse, her husband, placed in a smaller group home setting in Maryland that were able to cater to his needs. He had cognitive memory impairments, and he did well there in that setting.
So that makes sense. It's just depending on what's going on with your health, what type of assistance you need, and what they're able to do, depending
I
on.
agree. I think a lot of people were drawn to the smaller 8 beds because you have a tighter staff to resident ratio, and that's important for a lot of people. But like Denise said, I think it's really going to depend on the individual's needs.
Great. Thank you so much, ladies. Another question is, what tips do you all have for someone who is doing long distance caregiving, especially for a loved one who is not in Virginia? So if somebody's living here in Virginia and they're long distance caregiving for someone in a different state, do you have tips? Do you have recommendations? Definitely just going to throw it in there. Call, figure out where the area agency on aging is, where they live. You can Google search that and just North Carolina, blah, 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 area agency on aging. And there, because every single state has an area agency on aging. I just put that in there. Ladies, you take it over them.
That's great, Allegra. Yes, that is a great start. Yeah, I think it's trying to expand your support circle to where your loved one resides, just so you have some eyes and ears who could stop to check in to see how your loved one might be doing. There is a lot of stress that's associated with long distance caregiving, just since you can't readily see with your own eyes and ears what's going on. So you might have someone who underreports what's going on and the roof could be caving in, or you have someone who goes the other extreme when, it seems to be a minor issue that could be easily resolved. So getting local support in place. Along with that, sometimes there's a hesitancy to let people into the home. So oftentimes, a volunteer coming in to do friendly visiting or maybe assist with grocery shopping is really a nice way to start introducing the concept of potentially bringing more support into the home, if needed. I think Denise had mentioned earlier the use of technology. So, again, that needs to be a discussion, not necessarily, a camera being set up, but the use of Alexa or maybe, having regularly scheduled check-ins just to provide peace of mind to everyone, that there is some regular contact occurring and that needs are being met to the extent possible.
Yeah, and I would also add to what Kristin shared. Um, for example, if the person you can set up now technology is wonderful. So even with doors, I've seen, the keypad doors and communication with the local fire department in the event they need to enter the home, having pendants, the fall pendants, different types of devices in place. Um, as said earlier, if they are allowed to have cameras in certain areas and the support system, and even if the person, I don't know if you're still driving, but I know I have a loved one who's still driving. They're driving safely, but they are older, almost 90. And we are on the same phone system, which is good. So I was able to find out when he was stopped on the side of the road, 911 was called. So my phone was also alerted based off the plan available, and the state trooper was there and taking care of things. But it's important to see, look at so many different devices available, but nothing replaces a human being, right? So having that village to support you. And maybe, if you don't have family in that area, looking into a service where someone can check on them periodically.
I would also add if their loved one's in a facility setting, um, obviously if they can visit, if they can travel and visit their loved one and put eyeballs on them, that is ideal. But if they can't, maybe they can establish with facility staff a point of contact, someone that they can touch base with to get regular updates on their loved one periodically throughout the year. And also using technology to be able to attend care plans meeting, whether it's just calling in on the phone or maybe FaceTiming in or doing a hybrid meeting if the facility has that capability where the person can be on the TV and can, zoom in. I think those are all easy ways or helpful ways to be able to still be involved from a long distance.
And I would definitely just add and recommend, if you can't get out, if you could get out quarterly, or I don't know if it's 4 or 5 months, it is important to personally put your eyes on your loved one. I think that's important. I know I've experienced myself. It's important to be able to do that.
Question, is it the Ombudsman program national?
Yes, we are part of the Older Americans Act. We're a federally mandated program, so we're available in all 50 states.
So that's another thing too. If somebody's looking in, or if they're using a home care or, in a facility, they can connect with their ombudsman in that state as well, correct, to get support.
Yeah, they can give us a call if they have some questions about the facility or something specifically has come up with their loved one that they would like for us to get involved in. They can give us a call and we can look
Perfect.
into it.
A question came in about the ombudsman again too, was do ombudsmen cover home care agencies?
We do. I will say 94 or nine, higher than that. I'd say 99% of what we do involves a facility setting, whether they live in assisted or nursing. But in the state of Virginia, long-term care services also include home care, home health, hospice, adult day health care, the PACE program, those that may be at home getting Medicaid waivers. So yeah, we can get involved if they have a concern or an issue with that service.
Great, great. Thank you. Another question, how would you all address the conversation with a married couple in their mid to late 80s? One of them, whom obviously has some form of dementia or cognitive decline, and the other who is suffering from the strain of caregiving, both whom refuse care or help.
That's a big conversation to have, and it's usually not resolved during one conversation. So I think it's a matter of, maybe in this case, really speaking with the caregiver. And it goes back to that caregiver self-care. And, while we may truly want to be in the position of always being available for our loved ones to meet their every need, eventually we're going to wear ourselves out and we'll no longer be in that position to be as strong a support to our loved one as if we were taking advantage of having these little opportunities to refresh ourselves as the caregiver. So having a conversation to figure out, what is important to them as a couple. What is it that they are hoping to accomplish by either staying at home or whatever how do I want to put this? But what matters most to them, and then trying to figure out how can we piece together different supportive resources to help them achieve that goal. Sometimes we might have conversations time and time again, and unfortunately, it may take something more significant happening to actually make someone finally agree to accepting some type of support, but to be available and understanding with what our loved ones are trying to accomplish. So that refusal of care, although we might get frustrated on the outside because we know it could be a little bit easier for them, it's still respecting where they're coming from and seeing how we can gradually continue to work with them, have that conversation, and incrementally maybe increase them care.
Thank you so much, Kristin. Sorry, anyone else want to add? Okay. The audience member thanked you for that. Thank you. Thank you. Does the Ombudsman program release any type of rating report on the facilities they monitor? For instance, reports like those for schools where they compare their performance statistics to the other schools in the nation.
Locally, no, we do not. Our data is protected, federally protected. So the state ombudsman office has access to our data, and then subsequently they report that data to the federal agency that oversees the ombudsman program nationally, which is the Administration for Community Living. But we do not put out a specific report for all of our local facilities, and we don't break down data that way and report it to the public. But again, as I mentioned earlier, if someone has questions about a specific facility, they can call us, or if they don't live in our area, they live somewhere, they can call their local ombudsman office and request aggregate data regarding a specific facility. How many times, over the past year, have you gone in for investigations? What types of things were you looking into? For example, we had to go in and talk to someone about medication administration, or there was an issue with activities. That kind of information we can give, but we have to be really careful what we release because we don't want to release any identifying information that would put the confidentiality of the residents in jeopardy.
So is there anywhere that people would look for that I mean, it sounds like it's very much self-investigation. If you have you're caring for someone, it's really, and you're looking for higher level care, it's looking with the Ombudsman, it's looking on some of the websites you all talked about. It's visiting and figuring out what's really just the best fit, like a shoe for that person. But is there nowhere where they say this is the best and this is the least, the
Well,
best?
so for nursing, and Denise might want to talk about this too, CMS, they have their website, Nursing Home Compare, where you can also go on there and get what they call star ratings. And I think it's anywhere from like 0 to 1 to 5, 5 being the highest level of care. And so there's specific data points that CMS uses to determine those star ratings. And so that's a really good resource for nursing facility. For assisted living, because they're regulated at a state level, so it's going to look different depending on where you live. In the state of Virginia, I would recommend, again, going to the Virginia Department of Social Services website and looking up the individual facilities to see what the inspectors are finding when they go in and do their investigations.
Great, thank you, thank you. Another question. For a loved one who's in early stages of dementia, how do I find all these things that you're discussing? These resources when the person is still independent, but we know will decline. How do I know what I don't know, what is available, or what can I set up? The phone situation that Denise mentioned is interesting. And I'm going to let you all take this question away, but one thought I have is, if you're a resident in Fairfax County, Kristin mentioned earlier that we do provide caregiver consultations. This is free of cost. And so to figure out what's working for your specific situation, what resources are for you and your income levels and you know where you reside. I don't know if you're a Fairfax resident, but if you are, I just want to throw that out there. We do consultations. You can connect with us. You connect with Kristin and we can get you that. But I'll let you, and I'm just going to remind the audience, all the slides and the resources and the handouts will be emailed to everyone and this recording. So some of the resources we're chatting about will be shared, but I'll let you all answer as well.
Yeah, no, thank you for that, Allegra. Yeah, certainly if you're within Fairfax County, a caregiver consultation might be a great start. And I think, you know, trying to be as proactive as you can when you're not in panic mode, needing to get information is a great way to approach. So, you know, coming through with a recent diagnosis and just trying to see what supportive services are available. Particularly in Northern Virginia, we are very fortunate to have a wide variety of supportive services really geared towards working with folks who have dementia. You know, so and that's where ElderLink, with you know us being a little bit more in the know with the available resources, can help to guide a family. But there's Insight Memory Care Center, which does a wonderful job of supportive programming and educational opportunities for caregiver. There is the RAF Dementia Program as well. So a lot of really solid options that we can help to guide people to see what might be a good fit given their particular situation.
Perfect. And that audience member is a resident, so
Oh,
I do
great.
encourage you to give us a call. Earlier you mentioned the word PACE, Camden. You said the PACE program. I wanted us to just share a little more about what that is, because when we talk higher levels of care, that doesn't necessarily always mean assisted living or nursing care. It could mean bringing higher levels of care just to your own home. And Denise mentioned earlier, and everyone mentioned earlier, that could look like just bringing in more support to the home, maybe adding a ramp so that you can go up safely up steps, bringing in volunteers to visit, to do groceries, or home care agencies, whether it's a volunteer agency or for private pay. Kristin's programs a sliding scales options as well. So there's a lot of different options when you need to bring people in the house to make it safer for that environment. But PACE is another interesting program. I don't think a lot of people are aware of. And so I don't know, Camden or anyone, if you could share what is PACE and how that could help with maybe bring in another support with the
Yeah,
higher level of care.
I can do my best to describe PACE. I don't have a ton of experience with PACE. So they're a very interesting model of care. PACE stands for, and you're going to see me look to the side because I actually have something up on my other screen about PACE. I'm going to use it as a sort of a cheat sheet here. It stands for Program of All-Inclusive Care for the Elderly. It's called PACE. We have one PACE location here in Northern Virginia, which is in Alexandria. It's called Cherry Blossom PACE. But there are other areas within the state of Virginia that also offer PACE. And so it's an interesting program. It is considered a community-based program. And so you have an individual who can have both Medicare and Medicaid. And it provides a very comprehensive model of care. They can get medical services, social work, transportation, meals, in-home care. They have a day center where you can go, much like an adult day healthcare, where they have social activities. And then they have, usually that's where they would go to access it's called a primary care. They really sort of manage almost everything, all aspects of life for PACE participants. And it's a nice program to have in order for someone to stay in their home for as long as possible.
Sorry, I was muted. Thank you. Thank you for sharing on that, Camden. I myself at one point was a long distance caregiver and utilized PACE in a different state for my father. And I have to say, it was just such a great option because they transport, they pick you up, and everything's inclusive. All your primary doctors, like Camden just said, and social activities and different things like that are happening in that center. It's a little more than just a day center because it really is taking care of all your doctors are there, all your x-rays, everything's there. So just a great option to look into and think about. And also just to share with folks, if you do have someone in early stages of dementia or different, declines, Camden mentioned the word adult day healthcare centers, and not everybody knows what those are either. There's technical terms. And so an adult day healthcare center, can one of you share what that is? Or like just an idea of what that would be?
Well,
I'll
go
let
ahead.
Denise take this one.
Well, I do know when I worked in the District of Columbia, I worked where we had an adult day center and we provided the meals there. We provided breakfast, lunch. We had activities for the day, depending on the level of care. At that location, we even provided, if someone had incontinence care, we provided support with that. So it's a program during the day. I've seen people utilize it. Sandwich generation. If you're working, you can have your loved one there while you're at work, pick them up, bring them home. I do know in some other city areas, they actually have programs, I think, that provide overnight services. So it is a good option to be able to utilize, whereas your loved one is in there 24/7.
Yes, yes. It's
Mhm.
just another way of bringing in support. And here in Fairfax, we have multiple locations that we do provide adult day healthcare centers, and you can call and schedule talking to the nurse and do tours and see if it's the right fit for you. And I know that there's different like sliding scales, and they have different options with how you do different payments and different things for that. So it's a great thing to look into because these are some options if you're not quite ready to go straight to assisted living or ready to go to, a different move technically and physically move. So just wanted to bring those things up, but we are at time. And so I just wanted to thank everyone on the panel so much for your expertise. Really appreciate it. And I want to thank the audience so much. I know that your time is valuable and you've been with us for about an hour and 30 minutes. And so we really appreciate you too. And as I mentioned earlier, everyone will get the recording and the slides within the next week. And I wanted to remind you, we are having that short survey as you hop offline. Please fill that out for us. Let us know your comments. Let us know if you enjoyed this and if you have any feedback. Also share with us what topics you're interested in. We create all our programs based on what our audience wants. And so just let us know what you're interested in for next year's programming. I wanted to invite everyone as well. We have another session of Dementia Friends information session, and that is coming up next Wednesday, December 11th. So if you're available, come join us online for another program that we're doing. And that's about it. So, folks, I want to thank you so much again, and I hope everyone has a terrific Friday and a great weekend. Thank you again so much to my panelists. Really appreciate you all. Take care, everyone.
Thank you.
Thank
Bye.
you. Bye-bye.